1.7 lakh vaccinators and 3 lakh vaccination team members have been trained to go for what is going to be the biggest vaccination drive in our country. Hi, my name is Arun Singh. This is FYI. Today, we discuss the mega dry run, which is planned by the government, and it's happening tomorrow. We discuss the challenges, learnings that we've had from dry runs of the past, and also some other elements related to dry run. But first, very quickly, let's talk about the dry run exercise that is going to happen tomorrow, which we're calling the mega COVID vaccine dry run. So India is ready for the second phase of dry run, because the first that we saw happened on 2nd of January. Now, in this one, cold storage will be assessed. Then there will be transport arrangements assessed here, and management of possible side effects will also be taken care of. Then this will include mock drill at various vaccination sites, and this will check preparedness of management as well. And the aim is to avert any adverse events or side effects following the immunization. The first dry run that happened on 2nd of January was held in 16 centers of 5 states. If we talk about major states which have had a vaccination dry run in the past, these are Punjab, Assam, Gujarat, Uttar Pradesh, Andhra Pradesh as well, and the national capital for sure. Now, this time there are multiple health centers which have been identified. We'll get into that as well. But before that, let's quickly have a look at what the process of dry run really looks like. So first is, of course, the beneficiary verification. The person who comes to get vaccinated, inoculated, is first verified. Second is the vaccination, the simple process. Third is going to be the cold chain management. Then there's biomedical waste management as well. We have AEFI management as well, which is adverse event following immunization crisis. And then handling the COVID software. Health Minister Dr. Harshvardhan addressed media today, and they spoke about the challenges that were faced in the last session of dry runs, and challenges related to COVID software, which is a digital infrastructure created to run this vaccination program, were identified. We have a great panel lined up with us. We have Dr. Anita Ramesh Chandra, specialist in clinical trials, senior medical oncologist, Apollo Specialty Hospitals. We have Dr. Anish Sinha, Associate Professor, IIPH, Gandhinagar, has worked for WHO and UNDP for vaccines and immunization. We have Dr. Rakesh Mishra, Director, Center for Cellular and Microbiology, which is CCMB, Hyderabad, and Dr. Hemant P. Thakkar, physician and cardio-metabolic specialist. We have a great panel lined up. We will have our questions put across to them, and also some other stories which have come from the last dry run that happened. But my first question to you, Dr. Anita Ramesh, how crucial is tomorrow's dry run exercise? Because this is happening across the country. This is definitely a massive drive. Anyway, the inoculation drive of our country is going to be the biggest in the world. But how crucial is tomorrow's dry run exercise?
Yes, tomorrow's dry run is very, very crucial because it is happening in more than 700 districts all over the country, and it spreads from Kashmir down to Kanyakumari, from the east to the west. And this dry run helps us because we are going to have 2 vaccines, Covaxin and Covishield, which is already has emergency approval and is to be rolled out around 13th and 14th of January. That's the plan like. And this particular dry run has 3 objectives in mind. One is that to prepare the vaccination site with healthcare professionals, to transport the vaccine from the manufacturing by flight to the cold storage and then to the distribution area, how the cold storage is maintained, and at the vaccination site to see how the healthcare workers are trained to give the vaccination and manage the side effects, and lastly, how to use the COVID digital software, which has been upgraded, and it's called now EVIN, which is the electronic version of the, that's what the upgraded one, how to use that. So all these things has to be in place before we roll out the vaccine, because any hiccup, any problem, anywhere you get stuck, then the whole thing may get disrupted. So it's very, very important, the dry run tomorrow from a medical point of view and for the social safety, and that's why it is very, very important. And I told you the major 4 points which we can discuss subsequently.
Of course, we'll get into details of these points, but if we talk about dry run, so it's actually an exercise where health workers are administered with a dummy vaccine. My next question would be to Dr. Anish Sinha here. Since our dummy vaccine is administered here during dry runs, so how do we gear up for the adverse event following immunization crisis?
Yeah. This dry run, this is actually the third one we are having. The first one that was done on 28th and 29th of December, just to correct on that. And that was in the 4 states, initially one from the north, west, east and south. That was the states that we included were the Punjab, Gujarat, Assam and Andhra. Then we had the another dry run that was on the 2nd of January that you mentioned. And this is in fact, few states have done on the 5th also, and tomorrow's is I would say a mega dry run. Whole idea is lot of preparations have gone into planning the scale of mass immunization program. So the government wants to be absolutely sure that all the planning is in line with or linkages are there between the planning, implementation and the reporting mechanism. So the whole idea is to get into the field and ensure that everything works well, whatever is planned. Most importantly, the adverse event, whether the system is geared up to identify and if there is any, how that will be managed, the cold chain, the infection prevention protocols that should be there in the session sites. Now, importantly, that you said it's the dummy vaccine. Actually, in dry run, everything will be done other than the vaccine administration. So vaccines will not be administered as such. However, all other things will be mimicked. It's all basically a mock drill. So in terms of there will not be any AFI, but if it occurs, a scenario, how the health system reacts to it, responds to it, so that in terms of use of the adverse event following immunization, kits are available on the site. So how they handle that emergency drug, that adrenaline is there, and the transport and the shifting of the patient to a tertiary care hospital if required. So all this planning is there. They want to ensure that whether this works well in the field, and more importantly is basically confidence gaining exercise for all our frontline workers and all the program managers that we are well prepared for the coming campaign.
Just can I add one sentence to this?
Please.
Yeah, so just to one more word to mock drill. What happens in mock drill? We regularly do in our hospital. Suddenly what happened in a normal individual in the mock drill pan will suddenly fall down and act as if he or she is unconscious. So then we let to see the healthcare workers what they do. In mock drill also somebody will be there, just they will put the injection and he will collapse or he will have allergic reaction. He'll start sweating. Just is a makeup. It's an acting. That is called mock drill. You're acting as if you're sweating, as if there's a big chest pain, as if you're unconsciously fainting. So we do this type of regular mock drill to train ourselves. The mock drill person is a normal individual in the surveillance team who comes and acts there and will try to see how the healthcare workers do. So this is the mock drill which is going to take place tomorrow at different sites. Suppose the vaccine falls down from the hand. They will act as if it has fallen and broken. And what will everybody do? That is called mock drill or preparing like a mock exam as if you are in the same site and same thing has happened. They are all acting basically.
Right, great point made there, Dr. Anita Ramesh. Now, Dr. Rakesh Mishra, so Dr. Harshvardhan spoke about some challenges that were faced in the last dry run that happened on 2nd of January. And one challenge was issue related to the space. So, of course, they didn't go into the details of this, but they said issues related to space were found in the first phase of the trial. So, what do you think these challenges are which are related to space?
See, that will depend largely on if somebody is not perceived what kind of space is required. Normally, these things are very standardized. We have experience of vaccination large scale. We handle things like general elections, so large number of people, and those are the inputs that have been provided in the planning, and that is how the whole system has been laid down. And if some places, see, that is why the dry run is required. Although everything is on the paper, but unless you do it, many people have different perception of what is written and what is told. When they do it, then they get the real feeling, and many people may not read the whole protocol, whole SOP. So those are the things that they will get sorted out in these dry runs. I'm very happy that government is taking so seriously dry runs, because that's very important. So tomorrow all states except maybe 2-3 states are going to do in all district headquarters. So these are the exercise so that we don't have any afra-tafri in the middle when the vaccination begins.
Have we seen dry runs like these in other countries, Dr. Mishra?
I'm not sure, but I think at least I didn't come across, and that's why maybe US or UK they are having lots of confusion and problem. First of all, they're not experienced to this, and their vaccine also a little bit tricky. Minus 70 hours is much better option. So I think, and see, actually in vaccination thing, India is far ahead of any other country in the world. So I think we will be setting example how to do such a large scale vaccination program, and dry run is a part of that.
Okay.
So what we have added very important in this is data entry and creating the database and the retrieval of data to follow up the people. Remember, these are all emergency use vaccine. They are not approved vaccine. So very careful monitoring and follow up the patient is extremely important, and that's going to add tremendous value to the vaccination for this pandemic and in the future in general for the healthcare, because this kind of digitization of the identity based data we don't have in our system. So these are something which will be a tremendous benefit for now and in near future.
So when the vaccination begins, of course, the first batch is going to be of health volunteers or frontline workers. But the second batch is of around 27 crore people who are above the age of 50 and patients with comorbidities. But Dr. Hemant Thakkar, so patients with comorbidities will need special attention at these centers. So what do you think? Of course, we were talking about space also here. What do you think are the risks here?
See, the idea of a dry run is that practice makes a man perfect. When we talk about resuscitation in our ICUs, we have so many mock cardiac arrests. We have so many mock heart collapses and pulmonary resuscitation. And every few weeks, these dry mock drills continue in our ICUs. So it's a great thing that we are doing a dry run, because forget the patients with comorbidities, anybody can get any one of the two important reactions. One is the acute reaction, where there is acute allergy, for which people are getting placed to be made, where they sit for half to 1 or 2 hours, depending on what they see after examination. And for those comorbid patients with diabetes or blood pressure, who are made to be observed longer, who are observed for a longer period of time, for fluctuations in their pulse, heart, etc. But by doing these dry runs, we make sure that the facilities are available, the people working at the facilities are conversant, and that will instill confidence both in the vaccinator and the vaccinated. So this is a great thing. India has a very good primary health center experience. We have a great history of vaccination. So I think, especially for our comorbid patients, patients who need help, patients who might need a doctor on site to placate them, to examine them, to treat them, we should be prepared as doctors for the worst in the form of a reaction, and patients should be optimistic that reactions are hardly, if any. So I think this is a great program, and I think the country is putting its best foot forward.
Okay, if we talk about places where dry runs will be conducted, so each district across the country has been asked to identify 3 types of sites. So first is going to be a public health facility, then a private health facility, and then a rural or urban outreach sites. That is what Union Health Ministry has said, briefing the media on Wednesday about these dry runs. Dr. Ramesh, my next question to you, Dr. Anita Ramesh here. So, of course, this is going to be a mega drive, and we've had multiple vaccination drives in the past which have been successful in the rural areas. But here, because there's such a digital infrastructure created around this drive, do you think that is going to be challenged here in the rural areas?
Yeah, might be, because many of them may not be having that Android mobile or a mobile which will support this app. That is one thing, and may not be also versed how to use the app, because of might be it is quite reasonable. So in rural areas, if you want to convert everything into digital India, or what we need some IT people to be supporting them to get them done on their mobile, or to put it in some other mobile and save the data. So that's going to be a big hurdle as far as rural India is concerned. Yes, the digital portion may be difficult, whereas the medical portion should not be difficult, because we are having healthcare services down to the villages. But definitely I agree with you, the app digital is going to be, until and unless somebody does it, or the health center takes responsibility to update the data digitally, that's going to be a little difficult. That's what I feel.
Okay. Dr. Sinha, how important will the transportation part be from storage point to the center? How important will that be?
Yeah. Just to add to your previous thing, the madam was saying that regarding this IT, of course, this will be an issue in rural, but at the same time, this CoWIN platform is the upgraded version of the EVIN, the Electronic Vaccine Intelligence Network, which was there in all the 29,000 cold chain points spread across the country. So that's functional. Of course, there are internet issues. So, but by and large, people have been trained for this to use it. The cold chain handlers, the ANM are using different like ANM Online and others. So there have been practice in using such health-related mobile apps. So, and the special trainings have been imparted for CoWIN also. So by and large, the usability will be good. The internet issues may remain at some of the rural places. The second thing that you asked is regarding the transportation. So already there is a system developed for transporting of the routine immunization vaccines from the manufacturer to the state vaccine stores, then through flights or refrigerated vans, and then from state to regional and to district through insulated or refrigerated van. So these systems are in place, and finally from the cold chain point, which we call it the last cold chain point, are primary health centers or the CHCs or the government hospitals, and from there to the session site. So all these plans are there. So last mile is taken care through the transportation through the vaccine carriers, and other mechanisms are there. Which is already in place for routine immunization. Same has been leveraged for this.
Right. So there's a reason I spoke about this, which is the transportation part from storage point to the center. I'm taking a very short break, but after the break, I share one blooper which happened in the last dry run, where vaccine was transported on a bicycle. Interesting visuals there. A short break, and we'll be right back. This is FYI, and today we are understanding the mega dry run, which is going to happen tomorrow. We have a panel of experts with us, but just before the break, we were discussing how transportation is so crucial of the vaccine from storage point to the center. Now, we'll quickly show you, before we go to the discussion, a blooper that happened in PM Modi's parliamentary constituency, Varanasi, where vaccine boxes were transported on a bicycle to Varanasi's District Women's Hospital at Kabir Chaura from the vaccine storage center at the government hospital, Chowka Ghat. This is during the dry run of the vaccine that began at 6 centers at 10 a.m. in the area. So this, of course, happened in the last dry run that happened in the country, and tomorrow there's a mega vaccination drive happening. Dr. Mishra, there are few bloopers like these meant to happen in dry run, and this shouldn't scare us, right?
I would look at it differently. I think, see, this is a scale is of unprecedented nature. And you may have seen pictures where India has carried a rocket on a bicycle and Belgadi at some time, and where we are in space science today. I think if from a center you are carrying in an ice box something which reaches in half an hour or something, and I guess nobody will cycle more than that in this kind of weather. So, and what is important thing is in box, proper ice stock is there. so that when the vaccine reaches to the place of delivery, the ice is still there. As long as ice is there, whether you carry by hand or motorbike or cycle, it just doesn't matter. What matters is temperature is 2 to 8 degree, and that can be maintained in this. So I would consider this as innovation, where instead of waiting for something, car, vehicle or something, if in 15 minutes you can take it from center to deliver the vaccine, that is a better option than you may also find some situation where car driver is taking and then having a tea on the way for half an hour. So those are the part of the thing that can be monitored and seen that at what time the vaccine left and what time reached. But I'm really not worried about. There are very, very few things about this which are very good about this vaccine. One is that temperature requires just ice, and that is good enough. You mentioned comorbidity and all. Anything else about the vaccine, we are not sure, because the time has not, enough time has not been there to see how long it will protect and so on. But these vaccines are very safe. All the trials have shown. So people with comorbidity or anything, that's why they are even recommended to go and take the vaccine, older people and people with comorbidity. Those are actually advantages of this vaccine. So, I think the way, if it was a -70 storage vaccine of Moderna or Pfizer, I would be worried about this kind of transport in that case. But if you are carrying in the proper sealed ice box, I don't see that is really something to worry about. In fact, in certain situations, I will say that it should be encouraged.
Yeah, I would like to add to this.
Although in this case, sure, I'll come to you. But in this case, the medical officer of the area has said that a vaccine in rest of the centers was. It actually reached in vans, but it was just one case where this thing happened. Yeah, go. You were making some point. Go ahead, doctor.
Yeah. See, we should remember that we have been eliminated polio from our country, and you would have seen so many of workers, our polio frontline warriors, carrying vaccine carriers with vaccine on foot, on cycle, and everything. And we have so it's not how you are carrying it. Important is it should be properly closed, and there should be 4 ice packs, which is mandatory in that vaccine carrier, properly frozen, conditioned, so that the temperature is maintained at +2 to +8. Of course, I am not trying to defend or this thing, but there can be better alternatives. But this alternative, as far as technical things are concerned, I would not say that anything is compromised here. Of course, there can be better alternatives, but there are many areas in a rural part where cycle, foot, even in flood times, where the campaigns were done using boat as a transport medium. So those are things which have been done earlier.
Great. Thanks, Doctor. I'm afraid we've run out of time, but it was great having each one of you here, where we understood the mega dry run exercise that India is going to have tomorrow. My name is Arun Singh. It's a goodbye from my side.